Hi, today we're talking about knee pain and some of the most common causes of knee pain. Especially in women, like 90% of knee pain is caused by the thigh bone or the femur tilting in this way, putting a lot of torsion here on the kneecap, and then changing the alignment of the knee joint. So what happens is when that femur bone's tilting in, that kneecap actually doesn't track correctly on the bones underneath, causing a lot of friction, grinding. That's what causes pain, swelling. Sometimes you'll even feel like a grinding or sandpaper type sensation, or even hear kind of that type of noise when you try to bend your knees, squat, get down on the ground, things like that. So proper knee alignment, especially when you're bending or squatting, is to make sure that you keep your kneecaps right over the foot. You don't want your knees to deviate in like this. You want it right over the foot. And some people find that position really, really challenging. A lot of times this could be, a habit. You've gotten in a habit of your knees going in like this. You don't realize it's wrong, and sometimes it's hard to break those habits. Other times it can actually be some weakness that's occurring here in your glute muscles, specifically glute medius. So an exercise that you can do, let me get a band here, to start strengthening this is to take a band like this. This is a pretty tough one, and depending on how strong you are, you can use, tougher or easier bands. But you take that band, you put it right around your legs just above the knee. You place your feet out in squat position, so you don't want to be turned out like this. You don't want to be in real narrow like this, so kind of that in-between squat position. Kind of like the position you would land if you were to jump forward or something. And then you're going to press your knees out into the band and then sit back into your squat. Now, if it makes you nervous to do it like this, you can always, sit back and tap your butt on your bed or a chair and really focus on pressing your knees into that band, pressing them out, getting that good knee alignment so my kneecaps right over the foot, and take it nice and slow. Another exercise that you can do, same type of setup, is actually in a seated position like this. And you've got that band right around your knees. Your feet are out in that squat position. You let your knees touch. You press away. So again, we're really flexing those muscles in the side of the hips, telling your brain, hey, knee, we want you in alignment with the foot. Pressing it out like that. Good. And then you can mix it into those squats like I was talking about before, tapping your butt on the chair. So I press my knee out. And then now I'm doing my little squats, tapping my butt on my chair. You can do a few of these. And then I can stay here on the chair. And again, work those side hip muscles, those glute medius muscles like this. And basically you can alternate back and forth between the squats and then the sitting exercise until you are totally fatigued in your glutes. Then you can take off your band. And then I always like kind of doing a test run at the end, just to see if my body remembers how to do the squat the way I told it to. So move the chair out of the way there. And then you can repeat that squat again, and then see if it's easier for your knees to track right over your feet. Well, if you're having knee pain or you know someone with knee pain and you need help figuring out how to fix it without surgery, look me up. My website's ducatchiropractic.com. I can help you in person here in Bloomingdale, Illinois, or virtually online as well.